Now for the next type of sterilization, okay, which we'll actually be talking about, is the Falope ring or the Yoon band. Falope ring or the Yoon band. Now there are so many things here. This is electrocoagulation. This is what Pomeroy. So focus on here. This is a Falope ring. So don't be distracted about anything. Each of those other ones will make videos about them. We're focusing on the Falope ring, also known as the Yoon band. And from what you can observe from the picture, they tied what? They looped, okay, the fallopian tubes, then tied it on the neck. Okay. So it's also known as Yoon band. It's a method of female sterilization that uses a small elastic ring to block the fallopian tubes and prevent pregnancy. It's a mechanical occlusion technique. It's performed via laparoscopy. It's known for being very safe and effective. Okay, so it was developed by Dr. Yoon in 1970s. So a silicone rubber band with high elasticity is what is usually tied around that. Okay, function: the ring is placed over a loop of the fallopian tube. It will now compress it. It will cause tissue damage. So over a long time, okay, scar formations, all right, over a long time, scar formations, all right, and that will prevent eggs from passing from the ovaries down, or the sperm from passing from the uterus up. Okay, so laparoscopic approach, they just make small incisions, right, in places where they can just access the fallopian tubes. Okay, so special applicator grabs a segment of the fallopian tubes and pulls it into the device. The Falope ring is then released over the looped tube segment. Same process is repeated on the other tube. So it's typically done in a surgical center, and patients can just resume activities like within 2 days, right, so to say. So it's highly successful. It's minimal invasive. There's no mess up with your hormones, so there's no issues with your menstrual cycle. There's lower risks of terminal injury. Okay, so failure rate is higher than other methods though. Okay, there's no risk for ectopic pregnancies. Okay, reversibility can be done. That's if the tissues have not scarred. Even when the tissues have scarred, you can cut it and suture back the fallopian tube. Okay, so tube damage, excessive tissue pulled into the applicator can cause lacerations. Okay, that's just by the way, but by and large, that's how the Falope ring or the Yoon band method is done for sterilization for females.